for joining. We're going to get started now. Today we have approximately 30 minutes, and just a reminder, one question, one follow-up. We have Dr. Williams and Dr. Yaffe here today, so I'll turn it over to them for some remarks.
Good afternoon. Monday. So today we're going to look at what happened over the weekend and looking what we're anticipating with how we're doing provincially in the week ahead with our numbers and that. So I'm going to first hand things over to Dr. Barbara Yaffe and for updates on data and materials. So over to you, Dr. Yaffe.
Thanks very much, and good afternoon. I want to start first by acknowledging that this is National Nurses Week, and our nurses have been working tirelessly to keep us healthy and safe. Thank you to all the nurses for your selfless dedication and the tremendous care that you have shown and you will continue to show to the people of Ontario. Thank you very much. Since the last update we provided on Thursday, Ontario has reported an additional 11,962 cases of COVID-19. That's 3,166 cases on Friday, 2,864 cases on Saturday, 3,216 cases on Sunday, and today 2,716. Our 7-day average of daily cases is 3,017, and that is down from a week ago where we had 3,577, and even further down from 2 weeks ago where we had an average of 3,917 cases. Sadly, we are reporting an additional 114 deaths since Thursday's update. This includes 47 COVID-related deaths yesterday, which is unfortunately the highest daily count we've had since mid-February. This brings our 7-day average for deaths to 30, which is up from 26 last Monday. As always, we extend our deepest sympathies to the families, friends, and caregivers of those who have passed away from COVID-19 and to everyone mourning the death of a loved one. We continue to see some improvement as hospitalizations and ICU admissions do continue to slowly decline. However, the numbers are still too high. Today, there are 1,632 people in hospital with COVID-19, and of them, 828 are in the intensive care unit. Our testing volumes were very low yesterday, with only 27,175 tests processed, with a positivity rate of 9.1%. The current 7-day average for percent positivity is 7.5%. There are now a total of 95,332 confirmed cases of variants of concern in Ontario. The majority of these are the B117 variant, first identified in the United Kingdom. The 7-day rolling average positivity for mutations or variants of concern has remained fairly stable, and today it's 74.4%. I'm going to now turn it over to Dr. Williams for additional remarks.
Well, thank you, Dr. Yaffe, and I also want to acknowledge National Nurses Week because of the tremendous work that goes on, some in very difficult situations in the ICUs day in and day out, and part of why we're working so hard with our public health measures, with our stay-at-home orders, and with our vaccine program rolling out as quickly as we can, is we want to get the numbers down. And as the number goes down, the admissions go down, and that it reduces the pressure and stress that right now in our overtaxed healthcare system we're dealing with and trying to give some relief in that direction. As Dr. Yaffe has alluded to, our numbers are down. Today, again, steadily making progress. And that's to congratulate everyone on what you're doing, to honor the stay-at-home orders and the different measures, and also to go out and get vaccinated when your turn comes. So thank you for that, but also thanking and giving recognition to the many nurses who are putting in hours and hours in very stressful situations and, of course, concerned about their own health, let alone that of their families as well. And so thank you for all you're doing. And I'd be remiss to note that in my family we have 3 nurses, and I'm married to a nurse as well. So everybody is in that area working the best they can. We want to bring you relief, and we want to make sure we get things settled for you as soon as we can through our many endeavors with public health measures and vaccination. So our numbers, we're cautiously optimistic. We're coming back down. Right now, for those who remember the modeling, we were on the yellow line on the cases. We're moving now halfway between the yellow and the green. That's a success. I'd like to be on the green, and we want to keep driving towards that as best we can. Our numbers are the fewest we've had since April 1, but it's only one day. We want to see that progressing and continuing over the days ahead if we can get down from under 3,000 every day and down ideally closer to 2,000 as we progress and continue the drive to getting off the third wave. Our vaccines. We've administered more than 6.2 million doses in Ontario to those who are eligible, and we're heading well past 40%. We're getting close to 50% of our eligible adult population, and we'd like to think about whether we can get not only to 65% by the end of the month. I think with the volume of vaccines, if they come through as ordered, and we are anticipating some larger volumes coming through, we might even push closer to 70%, but that's a lot of work ahead of us. A lot of work on your half. Thank you for booking, for taking the time to come. We are expanding, as in some of the news released today, the eligible criteria for that, and we're continuing to look at that as soon as we can to open it up so that we can make it available to all those that are eligible in Ontario, because we need those percents up in vaccination, which means the numbers go down, which means we want to get our ICU numbers back down again. But still, we're at a very high level of cases, even though 2,700 sounds good. That's still slightly above our peak in our second wave. So we do have our work ahead of us, but we're doing well. So at the beginning Thursday, individuals turning 40 and over in 2021 in hotspots communities will be eligible to book an appointment in the COVID-19 mass clinics that are being offered in many locations. High-risk healthcare workers will also be able to receive their second dose, and they can book soon. So before the 4-month interval, we had hoped to get there, and this is one of the first times we're seeing moving that direction. And we hope that if we can keep the vaccine supply rolling, and that other people waiting for their second dose, we would like to expedite that as well. But at this stage, we have to stage it because we have to be cognizant of the vaccine supplies that we're getting. But as soon as we can get it to you in the right way, in the right time, to make sure you're fully vaccinated and immunized, we will do so. So stay tuned and book when you have the opportunity, when you fit the category that's in there. But we have to continue having our public health measures in place. As I said before, some people think that once you get the vaccine, your first dose, the next day you're immune. Nothing could be further from the truth. It will take you 2 to 3 weeks, and the longer the period, the more, especially with some of the mRNA vaccines, the higher your effectiveness of your vaccine increases. So still follow the public health measures while you have been vaccinated, and you still have to take precautions because you can still transmit. Your chance of getting severe consequences has been reduced if it's after 3 to 4 weeks, but you can still carry it and pass it on to others, so you still have to be cautious in how you're handling yourself outside of your household and in those public and gathering in those locations. So I'd like to thank Ontarians for all you're doing. We had hoped with the modeling back 2 weeks ago that we would bend the curve. We are bending the curve. We are coming down off the third wave, but we want to get down the third wave totally. We didn't get down the second wave totally before the third wave hit. That has added immense stress on our healthcare system. We don't want to repeat that again. So we're going to have to be very careful as we go down to make sure we're well off that, and we're in a state where we can ease off the pressure on our healthcare system, ease off and get elective surgeries back booked. Necessary critical surgeries are already happening, but others need to happen as well, and to give a break for our healthcare system, our physicians and all the other staff and technicians and different people. And of course, with National Nurses Week, we want to give that break as well. So thank you for what you're doing. And now I'll turn over to the media for questions.
We'll go to the phone lines. Just a reminder, 1 question, 1 follow-up. Over to the first question, please.
Mike Crowell, ACBC.
Hi, doctors. Can you hear me?
Thanks, Mike.
Hello, doctors. Can you hear me?
Yes, we can. Thank you very much, Mike.
Okay, sorry. My apologies. Minister Elliott said that the numbers need to go down more before the stay-at-home order can be lifted, and you just made some reference, Dr. Williams, to wanting to make sure that the third wave is over. What are the thresholds that you think the province needs to meet before lifting the stay-at-home order? What sort of numbers do you want to see before the order could be lifted?
Well, that's a really good question, Mike. We're looking at that. I know after the first wave, and I was talking then about getting below 1,000 cases per day for a number of days. In the end of the second wave, we got down to 1,000 for about 4 or 5 days, and then it went right back up again. So we never did have that long period of numbers well below 1,000 to bring our ICU numbers back down to the baseline of 150 or less. The challenge now, we're dealing with variants of concern, and they are by far the predominant. That means their propensity to spread is much higher. And so I think our target, in my mind, has to be lower than that 1,000. We're trying to talk with our public health measures table to say what that might be before we'd be satisfied, because as you've seen in some areas where it seems very low, within a week or two, those have escalated and caused major outbreaks. So we have to use a different type of metric. The thing is, this time, unlike the first and second wave, we have vaccinations. And we have vaccinations going out, and we have vaccinations dropping the transmittal rates in our various areas. So I haven't got a definite metric right now. It certainly will be well below 1,000, but I think that is achievable with the two things happening, our ongoing stay-at-home measures and public health measures, and really getting out and get that vaccination done as we go above 40 to 50%, heading towards 70% of our eligible population.
Follow up?
And Dr. Williams, once Ontario hits that threshold and the stay-at-home order is lifted, which of the restrictions do you envision being lifted first? For instance, would face-to-face classes resume in schools? Would that be one of the first restrictions that is lifted?
Well, certainly we're anticipating what we can do. Schools, as we have said from the get-go, we want them to be the last to close and the first to open. So, yes, I would like schools opened again as soon as we can, as soon as we think our measures in place, because we have a number of features in our schools already that have set out to be careful and protective with our infection prevention control practices and that. We know that our teaching and school staffing are getting vaccinated as I speak, and that's working its way through, and that's an extra one we've added into there as well. And so we're aware, and our medical officer of health throughout the province would also like to have the schools open when they can and to keep that ready. So we're looking at that in depth at this time and seeing when we can do that, because we know it's important. It's important for the mental health of the children. It's important for their learning and development. These things are all critical, and we know our pediatric experts have been weighing in and different child psychologists. So this is an issue that's accruing, and we want to see if we can do that. So I would see that's one of the things that would be the first open, as we've always said, and it was one of our last things to close. So we're looking at that at this time, and we continue to look at our things around outdoor activities and getting advice from our experts on what we might do to utilize that to the most benefit in there and keep people safe and healthy while maintaining reasonable and proper measures.
Next question.
Dave Woodard, Global News.
Good afternoon. Dr. Williams, in many jurisdictions, people are able to congregate with others who've also been vaccinated. So once you get vaccinated, many times you're able to get together with other people who have been vaccinated. Now that we're approaching 50% of all adults being vaccinated, are we getting close to being able to allow that as well?
Maybe Dr. Yaffe will have a comment on that too, but I would say as we're heading that way, some jurisdictions have gone there and they've seen some outbreaks following that. So we want to make sure that we are making a decision at the right time when the transmission has reduced there. A number of our tables, both at the federal level with our counterparts, and maybe Dr. Yaffe want to comment on that, are looking at what does it mean in a partially vaccinated population versus a fully vaccinated population in relationship to the public health measures. So this is very much a topic of discussion at this time, but I'm going to see if Dr. Yaffe wants to comment on the question you've raised.
Yes, thank you. Certainly it's discussed regularly at the federal, provincial, territorial table. I would say that we want people to be fully immunized before we really open the gates to people getting together. And fully immunized with the vaccines that we're dealing with currently that are available means waiting at least 7 days after the second dose. So we are starting to open the second dose for certain populations, so we're getting there. But I don't think we're there yet. We have very high full vaccination rates in long-term care and retirement homes, where we have average close to 100% of residents vaccinated, fully immunized, and then we are starting to open it up in those settings. But in general, we're waiting for people to be more fully immunized.
Follow up?
Thank you. And I have a question, Dr. Williams, about outside activities. Whenever we ask epidemiologists at Global to explain how they're saying that being outside is safe, they send us data to explain their position. But so far, I've not really been able to find anything to back up the idea that keeping people inside actually prevents the spread of the virus. So is there data that informs the medical table or your decision? And are you going to release that?
So when you, it's a very good point. And when you say keep inside, we don't mean inside in congregate gatherings. We mean people are in their household and know the cohort they're in the group. That's the advice we have gleaned from, for a long time, from our science advisors, both in Public Health Ontario and with our science table here in Ontario, as well as at the federal and provincial and territorial experts. So we all agree that the less contact you have with other people, if that means inside, if it's inside, it's with your family and household members who you all have maintained very much steadfast restrictions of your activities and exposures. So that's what we mean by indoors. Outdoors, we've had advice from our expert tables that's saying because of the air movement, because of the UV radiation, etc., there's less risk. But even as the modeling table said last week, there are those three components you have to put together there. One is outdoor, second is mask, and the third is the 2-meter distancing still. If you're not with your household, you can go out and walk with your partner in that and do those things together. So there's things outdoor you can do, but there are some limitations in there, and that is coming from our various scientists and experts who have made those recommendations. So you have to have at least 2 of those 3 for your outdoor activity if you're not with your household. So I would trust the data from the various studies they've gleaned and the various I would call it analysis, sometimes term meta-analysis, from other settings to give us advice on the what we can put in as far as outdoor, and of course the ongoing benefit of staying indoor with your household, not staying locked in, but the more time you're less mobile, the less likely to come in contact with someone, or if you actually are sick and incubating, to give it to someone.
Next question.
Nick Dixon,
There we go. Good afternoon, doctors. Thanks for taking my questions. I wanted to sort of pick up on what Mike and Dave have kind of been getting at in regards to outdoor sports. We've heard in the last couple of days mayors and other politicians talk about the idea that the restrictions, golf, tennis, cricket, etc., sports where you don't necessarily have to be either connecting or contacting people, but you can be outside from a distance. When would you consider, or are you considering, potentially easing the restrictions on outdoor sporting?
Well, like yourself, we're getting lots of interest and correspondence that people are desperate to get into various activities. We're trying to look at how we might do that in a safe way. One of the challenges with some of these group activities as compared to individual where people go out and walk and jog and do various activities, is that the group usually comes to the place in a group, congregates as a group, and socializes as a group. So we want to look at how we might put that forward in a way. Just because it is a team activity, it tends to indicate a team collective behavior, as we've seen sometimes in the wintertime with some of our sports there. The pre-game and post-game activity was certainly conducive to spreading of COVID, and we were not excited about that. So we're trying to make sure if we put things out in that regard, how can you partake in that and yet not increase the risk, and keeping that formula that's the science table gave us of the 3 points, masking and 6 foot or the 6 foot or 2 meter distancing in the outdoor activity, which some sports are conducive with, some are a bit more challenging. So we're looking at all those aspects because we'd like to utilize the outdoor activities as much as possible.
Follow up?
My follow-up is regarding a Twitter thread over the weekend from Dr. Andrew Morris regarding the AstraZeneca vaccine and comparing it to the mRNAs. We heard the sort of information from NACI last week and them walking back the sort of preferred vaccination choice. Dr. Morris is making the case here that effectively it seems, AstraZeneca, the remaining doses are going to predictably lead to between 5 and 23 more deaths, many more cases of severe illness. He's effectively suggesting with the weights for the Pfizer or Moderna right now, based on how much we're getting in to Ontario, we shouldn't even be considering, it seems, using AstraZeneca unless it's absolutely urgent. Do you agree with his analysis? Do you have a different guidance? Is it still the first shot available is the shot we should be getting?
Well, I'll start with a comment, and Dr. Yaffe, it's an area that we are reviewing with our science experts at the tables, looking at the data and information around the so-called rare complication and how that impacts people. So this is an issue that we're reviewing here provincially. We're reviewing it at the federal, provincial, territorial level in there, and getting a clear idea of what is the risk. In that, there's a risk of getting COVID. That's very severe, as well as we're unfortunately seeing with deaths occurring in the younger age groups, some even prior to getting to hospital. So not having a vaccine and having COVID is risky. At the same time, what's the right balance? The point I think you said that Dr. Morris raised was with now we're getting a lot more supply of our mRNA vaccines, which has been pretty light for the last few weeks. This is encouraging. We haven't got a lot of the other AstraZeneca and the Covishield vaccine currently in our supply and stock, but we are encouraged that we believe we're getting more of the mRNA, both of the Pfizer and some more of the Moderna. And so that's encouraging to us. So we're monitoring the situation. We're looking to have some recommendations and other aspects consistent with our federal, provincial, territorial partners, and then to give the best advice we can to the public in there, the balance of the risk of the vaccine versus the risk of getting COVID. And the risk of COVID is not a benign issue, as we've seen, unfortunately, in Ontario over the last while, of some younger people getting quite ill and unfortunately actually fatal at times. So we are concerned about both. I don't know whether Dr. Yaffe, you have any other comments, or does that cover everything?
Well, I guess what I would add is each person needs to think about at this point, what is your risk of exposure to COVID? So if you're someone who is staying at home and you're really not going out and your risk is quite low, you might want to consider how long will it be till you can get the mRNA vaccine versus somebody who's in a hot zone who has to go to work. I think that's where you think about the different risks and benefits for you. I think that one of the good things to keep in mind is that we have such a very good comprehensive safety monitoring system now in Canada for vaccine adverse events. So any issues that happen with vaccines are reported and reviewed. So if there is an issue, we do get a safety signal, and these recommendations are reviewed very carefully, as Dr. Williams said, certainly within the province and across the country.
Last question.
Rob Ferguson, Toronto Star.
Hi, doctors. I just wanted to delve a little deeper into the targets. Dr. Williams, you're saying you want us to be well below 1,000 daily new cases. I don't think we've been there since October, and then things went haywire after that. So how far below 1,000 do you want to be, and what would your ICU target be, considering that you just said that even when we got down to 200 after the second wave, that still apparently wasn't low enough?
Well, Rob, I think that's exactly, it's a good point. I think what I'm saying is that as compared to the first and second wave, the big thing we have is vaccination. And as we go forward and get up to 60, 70% of the adult population vaccinated one dose, more and more with second dose, we've seen how effective it is in reducing not only risk of severity, hospitalization, and fatality, very much with one dose, but with two doses, even with transmission reduced. Even one dose with younger people reduces the transmission rate considerably in there. So therefore, our expectation is much higher. I think the point you're raising is that we didn't get down to 1,000, just barely under 1,000, a couple of days in the end of the second wave before the variants of concern took off, and we started going up the third wave fairly stridently. So we want that number down. We do have a few more beds capacity than we did. The issue we want to get them down for, as you're alluding to, is to get back with no transfers, relief for the staff, as well as start to lift Directive 2 and to start doing elective surgeries and backlogs on a priority basis and to make headway on those as soon as we can. So I think it has to be well below 1,000 with the variants. And the variants is a new issue. And they're much more readily transmitted, so we have to be a lot more cautious. But in the past, we thought, wow, can we get below 1,000 down to like numbers like 500 to 600 a day? If 70% of your population is vaccinated, I think that is not only reasonable, it's achievable. And so we'd like to do that so that if we're coming back down, we're staying down. We don't want to go back up again. We do not want a fourth wave. We don't want to have to close things back down again when we open up. So we've learned that before. This bouncing, opening and closing is perplexing to people, retailers, other ones, etc. So when we're down, we would like to make sure that we can open up in the right time, in the right way, slow and steady, and stay open. So that's our goal.
Follow up, and this is the last question.
All right, thank you. And can we get a ballpark number then on ICU numbers that you would like to see? Because I think what people are worried about is they saw things get out of hand back in February and March, and I think there's people worried that summer is kind of on the bubble here. If another bad decision gets made and there's another curveball from COVID, we could kind of end up being in trouble in July and August.
I'm not sure what you mean by bad decision, but I think the main thing is that if we variants, we're monitoring those. We see it's mostly, as Dr. Yaffe alluded to, are still the 117. We're watching our P1, the so-called Brazilian variant here in Ontario. Slow growth, but not exponential or massive. That's encouraging at this stage. The 135 holding, and monitoring some of the new ones like 617. Sorry about all the numbers. So we're keeping tabs. So we don't want to be caught off with that. We always want to be looking and to be careful. That's what caught us between the second and third, is the rapid rise of the variants of concern here in Ontario. So I think what we're trying to do is to say the ICU numbers, of course we're talking like down to 840. We weren't even talking over 500 back in the second wave. So we have a way to go. We've got to get all those patients repatriated back again. But we're coming down. And I think the lower we can get the numbers down, the lower the emissions, we can get that down fairly quickly. How low do we have to go? Well, our number 150, we've added more ICU bed capacity. 150, 200. We want to talk to our OH team to say what does that mean as far as capacity to have resumption of functionality in the hospitals. Of course, you're coming up to summertime, and some people have not had a break for a period. So you got to look at the overall wellness of your staff and how to pace things properly. So I think in that range there, around 200 is a good one to go to, but I would have to consult with our Ontario Health leadership and the overall hospital sector to see what is best for their capacity on a go-forward basis in that one. And as I said, we'd like to get down, we'd like to stay down, because then we have all the surgery we want to get caught up on and start making inroads on that as quickly as we can.
Thanks, everyone.